Dr. Khalid, Sohail, thank you so much for joining us. I want to begin the conversation today with an anecdote. When I was in my third grade in Multan, there was a
Yeah,
government school, and right one of the main public square in Multan, which is known
yeah,
as town hall,
yeah,
you know, Chowk Town Hall or
yeah,
Chowk Ghantaghar.
yeah,
One day when I was coming back from school to my house, right in the middle of the square, I saw one man. He had
yeah,
some feathers, some flowers on his head,
yeah,
and with a piece of coal, he was
yeah.
drawing something on the road.
Okay.
And most of the people around him were scared,
Yeah.
and asking other to keep away from him.
Hmm.
But one of my class fellow, I still remember his name, Abdul Hamid.
Yeah.
He went to him, and they were both very chummy, and he was talking to him. He was not
Yeah.
scared at all.
Yeah.
And I was wondering what is happening. And I found out that Abdul Hamid was his son.
Oh, I see. Okay.
Yeah.
Okay.
And this man, people, most of them thought he is mad, right?
Yeah. Yeah.
So they were scared of him.
Hmm.
But there were many characters like him in
Hmm.
Multan
Hmm.
in public life that I happen to know.
Yeah.
One thing I know which has always bothered me is
Hmm.
how much of it is a social judgment
Hmm.
or insecurity or misunderstanding, what we call mental
Yeah.
illness,
Yeah.
and how much of it is illness.
Hmm.
And is love an important ingredient of dealing with this,
Hmm.
like his son was doing with him?
Yeah.
And another anecdote I want to narrate, and then I will let you and Manu continue.
Sure.
Because we equate one madness with irrationality, with foolishness also,
Yeah.
which reminds me of another anecdote
Hmm.
that a person was driving a car and his car broke down right in front of a mental asylum. So there was a patient looking outside the window,
Yeah.
and he asked him what happened.
Hmm.
He said, "How can you help me?
Yeah.
You are, in a mental asylum." He
Hmm.
said, "But tell me, maybe I will be able to help you."
Hmm.
So he said, "I had, one of the wheel came off from my
Hmm.
car
Yeah.
and I've lost all the nuts." He said, "No problem. Take one
Hmm.
nut from each other wheel
Hmm.
and put it on this fourth wheel. And then when you drive close to a shop, then
Yeah.
get one for each of them." He said, "But how can you know this? You are mad." He said, "I am
Yeah.
mad. I'm not a fool."
Yeah. That's right.
So,
That's right.
yeah.
Yeah.
So I just want to open this about,
Sure. Sure.
what,
Yeah.
how this has emerged mental illness as a major issue in our time,
Yeah.
how much it has got to do with our judgments, with our knowledge, because in our traditional society,
Hmm.
these people were always respected,
Yeah.
and we use the word bhola for them, that
Yeah.
innocent. They are
Yeah.
innocent.
Yeah.
Treat them with dignity, with
Yeah.
respect, with care, with love. So I'll
Yeah.
just stop here. Yeah.
Okay. Good. Wonderful. Thank you for sharing the anecdotes. They're very insightful.
Have you ever, any point during your career, felt the need that you should have pursued a different pathway, or has therapist been, a one shot, like this is what I'm gonna do 100%?
I think as a teenager, there were a couple of other things that I sort of thought about. One was at one stage, because I liked with my dad, we used to sit after dinner and have very passionate, logical, rational discussions, debates. He will bring his book, I'll bring my book. So since I enjoyed that intellectual debate, there were a few months in my life that I thought I should become a lawyer, and maybe I should be, sort of have this argument as a profession. But then I realized that legal system was not a very, in my mind, does not seem very respectful or respectable. So I didn't. There was another time for a few months. I also thought I loved aeroplanes, so I even thought of becoming a pilot. You know, and to be just out of the curiosity. Later on, when I was in Ontario, I did go and took some lessons of the pilot. and I did get sort of 10 lessons in a small Cessna plane in Oshawa. But then later on, I realized that the Cessna plane is slower than my Trans Am car. So so it was, so I lost interest in that. No, but I think the doctor and I realized after becoming a doctor that being a humanist, because I had interest in philosophy, psychology, literature. So the psychotherapist part went well with my writer. So my being a writer helped me as a therapist, and my therapist helps me as a writer. So it's sort of my passion and my profession, they sort of build bridges with each other. That's sort of...
If you're comfortable answering, just a question about your father. So in Pakistan, I understand the culture around, Sufism and how it's associated with a spiritual well-being. And you mentioned that your dad had the spiritual breakthrough. But before that spiritual breakdown or the spiritual breakthrough, people were like, he had a nervous breakdown. Was that ever diagnosed? How was that dealt with in the family? Were there social consequences to it? I'm just wondering if you could elaborate on that, if you're comfortable.
Yeah. I think that's why I talk about it, because one of the things about mental illness is that we don't talk about. So it remains in the darkness, So I think talking about it, I think, helps people, educates them, and gets to know them. So I don't mind talking. I think the myth or the stigma becomes less when we talk about it. So no, my dad, when I had a breakdown, they took him to the medical doctor. I think some of his symptoms were he would drink a lot of water, and like 50, 60 glasses of water, and then go to the washroom very frequently. So they started with the medical thing. Then they took him to mental hospital. They gave him a shock treatment. Then he did not like that. He would not go back. Then they took him to the spiritual healers. This Babaji will write verses of Holy Quran on a china plate and tell my mother to drink it, and then that didn't help, so I think later on, after a year, my dad had some sort of epiphany, or he had some sort of, I should say, some insight about some of his past experiences. And I think that I felt led to the spiritual breakthrough. So there was a lot of discussion about that. The thing I noticed that to me was very touching was that my mother's family, my aunts, my uncle, my grandmother, they would look after him. They looked after him for a year. In the beginning, everybody will be up, put his bed in the living room and look after him. But then they got tired. So then they had to have these shifts, 4-hour shift, 6-hour shifts, 8-hour shift, And so I saw that family coming together, helping him, supporting him. And that is why my attitude is that mental illness just does not affect one person. It affects the whole family, the whole community. So seeing my father being looked after by the family gave me that insight as an experience that we should be very supportive to the person with emotional problems, because it's an invisible, you see. When somebody breaks the leg, you can see the cast. So the physical illnesses are more obvious. Somebody's coughing, somebody, have fever. But emotional problems, anxiety, depression, suicidal ideas, they are more invisible. So we need to be more sensitive to those things to help them. So no, I don't mind talking about it. So I think it was very, to me, in my formative years, eye witnessing all that, I think inspired me to become a more compassionate doctor and therapist.
Could you tell us about your current practice now that you are, a therapist, you're working? So a little bit about what you're doing right now, and what your job looks like.
Yeah. Professionally, I think I started in Newfoundland, then went to New Brunswick, then came to Ontario. So I worked in 3 psychiatric hospitals. I realized that it was a traditional psychiatry. That meant a lot of focus on medications, a lot of focus on giving shock treatment, custodial care. I was not very happy with that. So I felt that it was, not giving the patients proper care, proper support that they needed. So I imagined developing a program that I called a self-help program, so that people we need to educate people about their emotional problems. They can learn about their I give an analogy of diabetes. If somebody has a sugar diabetes, we teach them, take less calories, drink more water, go for a walk, do some exercise. I wanted the same kind of a model for emotional problems. So I developed a self-help program. And because of that, I had to move out of the institution, because the psychiatric institutions are very traditional. When you come up with a novel idea, with a creative idea, they are not very receptive. So I had to move out. In 1995, I started a creative psychotherapy clinic in which I developed this model. The other reason of calling it creative psychotherapy clinic is one of my sort of ideas is that children are born with some special gifts. Nature gives them a special gift. Somebody wants to be an artist, somebody a musician, somebody a writer, somebody a philosopher, somebody a scientist. But many traditional families and communities do not encourage. They ask them to give them middle class values, become doctors and lawyers, engineers, pay the bills and the rent, and big car, big house, big cottage, that kind of a thing. So when people are not encouraged with their creative activities, they get into a conflict with their traditional families, and that also causes emotional problem. So in my clinic, we practice two things. One is encouraging my patients to enhance their creativity, at whatever level. It could be, for women, it could be interior decoration, it could be baking, it could be sewing, it could be knitting, it could be crocheting, whatever art or whatever form of art that helps them in their sort of rehabilitation. And the second is, I think we'll talk about the green zone philosophy. So for the last 25 years, I have seen hundreds of people. We do individual therapy, marital therapy, group therapy, family therapy. So it's a combination therapy, I call it. And basically helping people to use less medications, not be in the hospitals, to live in the community. So my approach is more community based, that we should keep people in the community and educate their families so that they could respect them, accept them, cherish them, rather than labeling them and putting them in the mental asylum and forgetting about them. So this has been my approach. And I wrote a series of books about green zone therapy, art of living in your green zone, working in your green zone, loving in your green zone. We even created one for the schools. Now we are working with many students, and teachers and principals and guiding counselors. So a series of books have been written. And finally, we are even developing with Dr. Arifa Bhutto in Pakistan, with 3 PhD students. We are developing a green zone app. My wish is that by next year, there would be an app available, and anyone in the world, Urdu and English, if they want to follow this 7-step self-help program, that they could download the app and then follow it, so that even if they're living in a village, they cannot go to a big city, they cannot go, have an access money to see a psychiatrist. So I'm very my approach is very down to earth, very sort of grassroots, helping common people, educating them about mental health. That is my focus.
And generally speaking, are your clients, your patients, are they diagnosed with, for example, depression disorders or anxiety disorders? Or is it like anyone who's into wellness can come visit? Like, what's the general sort of demographic that you have?
You see, because we work in the medical model, so the referrals by family doctors, social workers, so they have a label, like they do come, somebody with panic disorder, somebody anxiety disorder, depression, so all those things are the diagnosis. But we teach them that the diagnosis is secondary. Your problem with relationships, your problem with the family, your problem with work. So we focus on the problems rather than the diagnosis, so I think, so anyone can come. People come with loneliness, people have problem with anger. A lot of immigrants come who have problems with their, adjusting. Like I see people, their teenage daughters, they are living in Canada, living in America. So they have one culture at home. Families are more traditional Muslim families, and they put certain sort of expectations from their daughters or even their sons. And these teenagers cannot fulfill that. because they go to school, they have this peer group. So there's a conflict between the school, between the university and the home. So I help many families, resolve their conflicts peacefully, respectfully, gracefully, to negotiate, to help them, a green zone communication, help to resolve conflicts in a respectful way. So I have a wide range of people that approach or that they come to our clinic.
So, Dr. Khalid, may I just ask one short question? That the mental illness that we talk about does it have its origin in unresolved trauma, either as a child or an adolescent? Or
I think when I give lectures to students, I call it a biopsychosocial model. The first factor is biological. So when there is a genetic part, it's like, because my father had mental illness, I have those genes. I know I have those genes, while my sister does not have those genes. So my sister has 4 children and they are all mentally healthy. I know if I had 4 children, one of them would have suffered from mental illness. So one is the genetic and the biochemical part. Second is the psychological part, the upbringing, especially the self-esteem. The children that are exposed to violence, children that are exposed to abuse, neglect, their personalities get distorted. They have low self-esteem, low self-worth, low self-confidence. They become insensitive to the social factors. They can become angry and violent. So I think upbringing is as important. And the third part is the social part. What socioeconomic class you are brought up in, immigration, and many social factors. So the biopsychosocial model. So in each person, we try to, when we are diagnosing, we are trying to ask the question: what percentage is biochemical? What percentage is psychological? What percentage is social? So the treatment is based on that. The biochemical part responds somewhat to the medication, the psychological part to individual therapy, and the social part to group and family therapy. So we make a combination, and that might change. As patients get better, they need less medications and more therapy. So I think there are multiple factors, and we try to understand each person in their own unique way.
Thank you so much, Professor, for starting us off. I just want to give a brief introduction to our viewers about Dr. Khalid Sohail. So Dr. Khalid Sohail is a therapist by profession, but he's also a humanitarian. He's published books and poetry. So thank you for joining us today. And leading with what Professor Fayaz has set the tone for this interview, I think I will just ask, how and why did you get into this profession? And could you tell us a bit about your journey, your academic and professional journey?
Yeah. I think before I focus on the profession, since Fayaz Bakr Saab shared that anecdote, I think being a therapist, the sort of the childhood experiences, I feel, help us or inspire us to choose our profession or our passion. So let me briefly mention 2 or 3 incidents or events of my childhood, I think, that contributed to my choosing the profession. The first one is that my father had a mental illness. He had a nervous breakdown when I was 10 years old. So for 1 year, I watched him. He would stand on one spot for about 2-3 hours. He will talk to the stars. So I think maybe he was hearing some voices or some unusual experiences. And the way Bakr Saab said that many of the relatives told me, because I was 10-year-old, not to go close to my father.
Yeah.
But I was so affectionately sort of connected with him that I would sneak into his room. Like when nobody was watching, I would go into his room. He will hug me, he will kiss me. He was very affectionate. He was never violent. He was never abusive. Although sometimes he would mumble things that I would not understand what he's mumbling, but he was very, very affectionate. So it took him about a year, before the crisis. He was teaching in Government College Kohart. He had a mathematics, he had done his master's, and he was a lecturer. And he was a very Western man. He was wearing a sort of suit and tie and clean shaven and, that kind of a thing. And after he recovered from his crisis, he became a very mystical person. He would wear simple clothes, simple food, simple sort of lifestyle. So I think most people thought that he had a nervous breakdown. Well, he believed he had a spiritual breakthrough, and people started calling him Sufi Sab and all that. So I feel as a therapist now looking back that experience at some level unconsciously would have affected me to become a therapist, to become a psychiatrist, to have involved. So that was one episode. The second is I used to watch, in Peshawar, there was these husbands. There was one particular husband who used to beat up his wife publicly. And I would be very upset, very upset with all that. So one day I told somebody that, we have to help this woman, this poor woman gets beaten up. But they said, they were very insensitive. They said, oh, this is a domestic problem. This is their problem. We don't need to get involved. So that was one episode that I think affected me. The third was in 1965, we had a war with India. 17 days war. We dug trenches. We saw bombs exploding. And I was only 13 years old. So I think these experiences, seeing human suffering in very close quarter, in my home, in my family, in my community, and then the thing that really bothered me was the prejudice and the hatred against Ahmadis. I had some friends who were Ahmadi, and people will throw garbage on their doorsteps. That was very sort of a bothersome to me, that how could human beings hate other human beings? So I think I'm just sharing these to set the stage that these experiences inspired me to become a writer, to become a doctor, and later on to become a humanist and a psychotherapist, so that how could we decrease human suffering? How can we increase human happiness? How could we live peacefully? How can we respect each other? So I think those were the general principles or the philosophy of life that I sort of adopted. Coming particularly specifically to the medical profession, so I went to Khyber Medical College, did my 5 years training, then did my internship, then went to Iran at the time of the Shah, then came to Canada at Memorial University, Newfoundland, did my 4 years of psychiatry training and got my fellowship, and worked in 2 or 3 psychiatric hospitals, and then came to Whitby, and I think developed my own type of therapy that we will talk later on in the program. So I think this was just, and then becoming a writer, writing my books. My uncle was a socialist writer, Arif Abdul Mateen, in Lahore, and he wrote in Punjabi, in Urdu. So I think he was a great inspiration. So I think profession as a therapist, as a doctor, and passion of a writer and a humanist, these two sort of went parallel in my life. So this is just in a nutshell to give you my background.
One more related question, because I think when someone at personal level has some idea of having mental illness or depression or anxiety, or their immediate family members, there's an element of stigma and shame of first confessing it to themselves that I am having a problem, and then trying to approach someone. Like when I came to Canada, I must give my personal example. In 1983, I had a nervous breakdown when I was a graduate student at Queen's. So it took lots of courage for me to approach the psychiatrist in the university, because I thought immediately people will get to know about it and it will create a problem. But then I mustered the courage and I went and talked to doctor, and he was able to help me. So how to deal with that barrier?
Yeah, so I think that is why these interviews that you are doing, we are doing, that's one of the reason I said yes to you people, that I think my emphasis is a lot on education. One of the things that is unfortunate, that a lot of literature that is on mental health is written by these psychiatrists or these experts or neurologists that is in a very difficult language. They use a lot of mumbo jumbo, sort of difficult language, as if one psychiatrist is writing to the other. The psychoanalyst will write, the libidinal cathexis of the ego has been sublimated to the unconscious. You don't know what the hell is that they're talking about.
Tyranny of the professional. Yeah.
So I think the green zone philosophy we have written in a common person, lay person's language, and the other is the community support. So we bring different people who are suffering or whose family members are suffering to have group therapy, family therapy. So I think when they are introduced to other people, they realize they're not alone, So I think group support, peer support, and education, and seminars, lectures, interviews. So basically, we need to educate people that it is not, because in Pakistan people still believe, they go to the mazars and they say ganda taweez, and they sort of all these jinn aa gaya, we have all these kind of myths where the education and the scientific, the logical, the psychological information is missing, so that's part of the issue.
On a related note, when people are struggling with mental illness and they heal from it, there's this, from what I understand, especially from people at school, people who I know are dealing with mental illness, they're always like, even if it goes away, it comes back later in life, or it'll come back in a few years, or they just refuse to take their medication because they're like, maybe I like being in this state more than I like being traditionally healthy. What are your opinions on that? Do you think someone can fully heal from mental illness? Can they become back to ground floors?
Yeah, I think because there is a wide range, let's suppose if we focus on depression, 50% of the people have one episode of depression and they never have it again. So many people have just one episode of some condition. Other 50%, they might recover from one episode, and then after 3 or 4 or 5 years, yeah, they might have another episode. But if we educate them, then we tell them that these are the early symptoms. Let's suppose somebody is taking some medication. I have patients, they took medication for 1 year, recovered from that episode, then for 4 years they were fine. The 5th year, when he started to have that symptoms again, now he's educated, so he starts the medications early. Rather than 1 year, it might take 6 months, and then he's okay. Then he can control the symptoms of the condition. And as we help them with other, improving their self-esteem, helping them with their relationships, helping them with their creative activity, helping them with their recreational activity. So I think, yeah, there are conditions that might come back, but if we are more prepared, then part of the treatment is the prevention. They say, prevention is better than cure. So the more you are aware of your condition, for example, I have a patient, we call it a suffering from SAD, SAD, seasonal affective disorder. So in the fall, he starts to have these symptoms, and the winter comes when there is no sunshine, when there's a lot of gray days, dark days, his mood is affected by the weather. So now we have a special, there is a special light, that is like a sunlight. Now people buy those lamps. There are special lamps that people with seasonal affective disorder can use. I also sort of ask him to go on a special trip. So he, in November and February, he goes away to Florida or to Mexico or to Barbados or somewhere. So people learn about their condition, and they then control the symptoms and learn how to deal with it. So rather than the condition or the illness controlling their life, they control their condition, like they control high blood pressure, the diabetes, or any other physical condition. They can also be educated to deal and, sort of successfully treat their own condition.
One short question, Dr. Sohail, thank you so much. Coming to the social context of the mental illness, the kind of self-image we inherit, the society gives us, which is very closely associated to the so-called concept of success these days. So that causes a trauma or conflict, within ourselves. My conflict with my own self-image. Yeah. How should I be living? And how should I treat myself as a successful person, not as a loser? Does it have to do, to what extent it has to do with the rampant, this issue of mental illness that is mentioned, both in Canadian society and Pakistani society? Yeah,
it's a very, very important question. How the society defines success. As I said, these middle class values of a big car and a big house and a big cottage and all that, and high professional success. So if the definition is on degrees and outward things, rather than a better person of moral character, of high integrity, and how you are not a hypocrite, you're more honest and sincere. So I think that is part of the education that we teach our children, we teach our young people, that how much character is important. I think we do not discuss the character. The second thing is the expectations. Many people who are high achievers, they found that a big number of people who suffer from depression are very obsessive, compulsive, idealistic, perfectionistic. They are very high ideals, high goals that are not achievable. So when they don't achieve that, they get disappointed and distressed. So I think having a more balanced lifestyle, having a life with integrity, that we can respect people. I talk about the folklore, the folk wisdom. Some elder people, I usually mention my grandmother. She only had grade 2 education, but I had a lot of respect for her. She was a very wise woman. When I go to visit her, in Lahore, Muzang Road, Lahore, from Peshawar, she would ask me as a child, "Sweetheart, you want to drink cold water or sort of hot milk? Do you want to sleep downstairs or up?" She will always ask me my choices. She treated me like a little person, not like a little child who has to be ordered. So I think we do not focus so much on wisdom. Knowledge is important. I'm not against knowledge, but knowledge is different than wisdom. Wisdom is a folklore, is a folk wisdom, and a lot of people with no degrees are wiser than these people with master's degrees. So I think the whole cultural milieu in the East and the West is to discuss our values and what is dear to us and what do we stand for, and can we sort of fight for those values that are dear to us. So I think that is a cultural and the social part that unfortunately we got so materialistic that we sort of left some of the values behind.
On this note, actually, one of the main things that Professor Bakir told me when we were inviting you was that you were South Asian. And this is like the first time I'm even hearing about a South Asian therapist, access to mental health for someone who is South Asian, someone who's specifically Pakistani. And I wanted to ask your perspective on this. What gaps have you observed in mental health care access in both Pakistani societies, but more broadly South Asian societies, and the discussions around mental health in these communities?
Yeah, I think that's very interesting, because most people or most therapists in Canada, they are white, male or female therapists, and their sort of the clients are South Asian or blacks or Latin American or Greek of the other cultures. In my case, it is opposite. I'm a brown psychiatrist, and most of my patients are mainstream white men or women. So it is other. And then I have some people from the East, South Asian sort of a background. I think one of the things that I want to highlight is that many times, even when the help is available, when mental health therapy is available, many South Asians do not go. Either they are not aware of the program, they're not connected with the community, or number two, they have certain belief structures. Just one example is kismat, fate. They say, "Ye meri kismat mein hai." So if it is in my fate, what can a doctor or a nurse or a social worker do? So they are sort of reluctant or resistant to getting the help that is available. So I think that is why I feel, give you a very personal example. One of my aunts suffered from schizophrenia, and her husband would take her to a spiritual healer, and because she suffered from schizophrenia, I suggested that she should take certain medications. She was taking a Modicate injection every 2 weeks. So she was doing well. She was very healthy. And then, so my uncle believed that it was because of the spiritual healing, and I believed that it was because of the injection that she's taking every 2 weeks and getting some help. Unfortunately, the Modicate injection in Pakistan became unavailable for a few months, and she got sick again, So then I sent her from Canada. We sent a 6-month supply till the pharmacies and all that. So I think the point I'm making is that people can have their spiritual beliefs. There's nothing wrong with that. Everybody has a right to have a belief. But at the same time, they should need some of the medical, the psychological help, that they should get that help, not give that up. So I think educating people that mental illness, mental condition is similar to physical condition. And the way you go to a doctor, see a nurse for medical help, you need to see a therapist and a psychiatrist for your mental health. So that is the part of the education that I think is still lacking in some parts of the South Asian communities.
I think that's important. I just want to mention one thing here because I used to visit this Khanqa in Golda Sharif, which can be translated as monastery.
Yeah.
And there are thousands of people who visit there and they talk to the Sheikh over there, Pir Saab. And it's very interesting. There were many cases of mental illness. People came there for taweez or blowing the breath on the patient, and they would always tell them, go to a psychiatrist, see an expert, talk to a specialist, give them medicine, and don't shirk your responsibility. Spirituality or faith has been confused with shopkeeping. There are people who do this business of selling these taweez and those things. And the people who are really spiritual, they know that this thing needs treatment, this needs family and social responsibility and individual responsibility. So in the name of faith, we should not do away with that responsibility and, or taking medicine. So that's very important to give that public message as well.
Thank you. Thank you.
So a question about your practice in Canada. What kind of concerns have you noticed in the Toronto community and the more broadly Canadian community that you think need to be addressed or that you think aren't talked about as much? If you could elaborate on those a little bit.
Yeah. I think one of the things, as I mentioned, that it is important to educate the children, the teenagers. So I feel that mental health education in school system is very crucial. We teach them maths, we teach them, music, we teach them science, we teach them philosophy, we teach them other things. But when mental health comes, we are not as efficient. So whether it's the East or the West. So I used to go to high school students and talk to them about mental health. There were teachers, there were principals, there were vice principals on their section of health. So they will talk about nutrition, exercise, and they will invite me as mental health. And I will have a dialogue with and these students, you will be surprised how intelligent, how bright. They ask very intelligent questions. Like this one teenager asked me, Dr. Sohail, this diagnosis, manic depressive. If manic is high and depressive is low, how can somebody be manic depressive? This is oxymoron. That was his question. And I said, it's a very intelligent question. What happens is that somebody is depressed at one stage of their life. After 5 years, they get manic. Then after 5 years, they're depressed again. So it is the overall diagnosis is based on their 20 years of their suffering or the lifestyle. So I think that there is a lack in the families, in the schools, in the colleges. And that is why this green zone philosophy that we have created, it is very it offers a language, an emotional language. Briefly, we use the traffic light model, the green zone, the yellow zone, the red zone, the way the traffic lights are. The idea is that when somebody is feeling very relaxed and peaceful and enjoying life, they're in their green zone. When they are a little frustrated, a little angry, a little sad, they're in the yellow zone. And when they are completely, losing control, getting very angry, getting so depressed that they're suicidal, they're in the red zone. So we educate them, the patients and people, that they can keep a green zone diary. And as they keep a green zone diary, it is self-awareness. Within a few weeks, the green zone hours increase and the yellow and red zone hours decrease. Now, it is so simple to start, although it is a complex model, but it starts at a very simple level so that people can talk about. Let me give you an example. I have a friend, Rashid Nadeem, is a poet, lives in Toronto. When the first book came out, The Art of Living in Your Green Zone, he shared with his children. They were at that time 5 and 7 years old. Then he called me next week. He said, Dr. Sohail, I want to tell you an interesting story. I said, what happened? she said that his daughter, who was 5, was crying in his room. He went there and he said, "Sweetheart, Afroz, what's wrong?" She said to dad, "I'm in my red zone. I cannot talk. So you go to your room and I'll come back when I'm ready." So after 5 minutes, she comes and she says, "My brother Imroz broke my doll." And that was, I was in the red zone. So my friend Rashid Nadeem said, "Sweetheart, what can I do for you?" She said, "If you promise to buy me a new doll, I'll go to the green zone. And if you don't buy me, then I'll stay in my red zone. So he was saying that although she used it to buy a new doll, but at least they were getting the concept. So rather than telling somebody you're stupid, you are acting like a crazy man, and you're this, you say you're in the red zone, I'm in my yellow zone. It is very neutral. So mental health, we do not have certain terms. We cannot communicate in a way. So I think it is unfortunate that in the West they have a lot of terminologies, a lot of vocabulary for mental health. In the East, especially. So I think there is a need of having mental health education in their local languages. So what we are doing now
Yeah.
is we are translating these English books into Urdu, into Pashto, into Sindhi, in Balochi. So we are trying to educate people in their own mother tongue. So I think there is a need of education at a very basic school level, family level, community level, so that people get educated.
And do you think that children or young people are more perceptive to education towards mental health? Do you think there's a gap, or do you think everyone is equally understanding the importance of mental health?
I think the children, because they're going to schools now, there is more modern education. They are learning a lot of things in the school. Uh, I feel the bigger gap is about the authority level. Unfortunately, in our Eastern tradition, the older people, the parents, grandparents, aunt, uncles, they have this authority. So many children, they become afraid of rather than loving your father, loving your mother, aunts, uncles, they are scared, they're afraid. So they are not that comfortable asking questions. So I think we need to encourage older people to welcome children and teenagers with their questions, and encouraging the younger generation, so that the difference or the gap between the older and the younger generation becomes less. The other thing is sharing one's experience. I think when the older people share their experiences with the younger generation, then they feel that connection. So I think we need to have, so in our green zone philosophy, we encourage a weekly family meeting, that once a week the family gets together after dinner and they talk, they share, they exchange their experiences. So I think the more there is a green zone family meetings to discuss different issues, dilemmas, their struggles and successes, their dilemmas and their dreams. So I think then the families can support each other, and also when there is a crisis, then they can deal with that in that way. So I think that's my notion.
Last question, Dr. Sohail.
Yeah.
What are the indicators, if that help us in detecting that someone is going to in his or her red zone?
Yeah.
Uh,
I think one of the fundamental things is that people have a certain routine. With their character, they have a certain routine. So what happens is that, let's suppose a teenager who is very social, he's going out, socializing in school, in the community, going for sports, and suddenly you see he stops going out of their bedroom. They start spending more and more time by themselves. They are disconnecting with their friends, with their relatives, with their favorite activities. That is one sort of a sign that we tell parents that when your children suddenly have a different kind of a behavior, they may not verbally say, but their behavior shows. They are withdrawn, they are not listening to music, they are not going out with friends, they're not eating, they're not sleeping well, and if you ask them, they're quiet. So then you need somebody, whether it's a relative or a friend, somebody they can trust. So I think change in somebody's certain routine behavior, sort of a normal behavior, should alarm us. The other thing is, many teenagers, they do mention, I'm feeling, I don't want to live, I want to end my life, I want to be, so people sometimes don't take that seriously. So many teenagers who have committed suicide, whether they hung themselves or they took an overdose or, I was in an accident, few weeks before that, they had mentioned, to their friends or relatives, but they were ignored. So they call it cry for help. So people with emotional problems do show. They might get into drugs. They might get into some gang activities. They might get into many things that it's against their personality. So I think any significant change in their lifestyle, in their behavior, we as elders, teachers. The other thing that I find is important is when there is a domestic dispute, domestic violence, there is a mother and father fighting and arguing. Many children are affected by that, so and they are quiet. They don't know where to go, So I think that's why teachers are now becoming more sensitive to the children who come to school, but they are sad, they are depressed, they're withdrawn. So they attend to their sort of emotional needs. So I think becoming aware of the emotional needs alongside the physical needs and the social needs, I think that is an awareness, that is raising social consciousness, that is sensitizing the community to the mental health. So I think those are the things that I think we can all do. I see that as a social responsibility, that we all are responsible, of all of us. We are all connected with each other. Let me end our session with a short poem. I will since Bakir
Please.
Saab is also a
Yeah.
poet, let me share, Manur, a short poem. It is called Peace. And the poem
Okay.
is, there is inner peace and there is outer peace. There is emotional peace and there is social peace. There is religious peace and there is political peace. There is local peace and there is global peace. These are all different colors of peace. And we need all these colors to create a rainbow of peace. So that is
Wow.
my gift for you.
Thank you so much.
Okay.
Thank you for
Okay.
ending it
All
on
the
that.
best. I feel honored to be interviewed by both of you. Thank you very much.
Thank you so much.
much.